Our guest today is the Chief Executive Officer of the Cook County Health and Hospital System. The Cook County Health and Hospital System is the third largest public health system in the country. Prior to accepting this position, he was a top executive for the New York City's public health system. Our guest today trained in India, England, and the United States. His primary focus is, number one, patient safety, and 1A, turning around the Cook County Health System's financial challenges. He is married to Dr. Ramanathan Raju, and they are the proud parents of a son and a daughter. Ladies and gentlemen, Dr. Ram Raju. Doctor?
Thank you, Jay. Thank you for all of you coming. And I really wanted to, extremely honored to be re-invited, Jay. Thank you very much to you and your club members for having me back here. Although I came from New York, I've rapidly became enamored by this wonderful city. And a bit more than a year, I think I have a good sense of the dynamic community which exists in this county. Most significantly, I have a good sense of the vital importance of the services provided by my institution, Cook County Health and Hospital System, to individual patients, to vulnerable communities amongst us, to the neighborhoods, and to the entire fabric of this Cook County. This realization is extremely humbling as I seek to honor the trust you have placed in me and my colleagues at the health system to ensure that this iconic healthcare system, a safety net for the safety nets, survives to continue to care for the most vulnerable population in our county. As an initial matter, I want to thank a lot of people, the board members of my Cook County Health and Hospital System, the group of voluntary, dedicated public servants, both past and present. Some of them are here, for thanking them. And I want to thank the President, Madam President, for an untiring support of me and my system during my stay here, and to the Board of Commissioners who really helped me at various times. They all helped me they support me as we work together to make dramatic changes that are crucial. We are able to continue our mission in this county. And I also want to thank many, many well-wishers who are all here, who through the last year, you advised me, supported me, and guided me. Thank you for being there. So after years of wondering, litigating, and politicking, now we are within 1 year of a massive healthcare transformation in this country. This transformation really makes all the elements of healthcare, the hospitals, the physicians, the managed care plans, drug companies, nursing homes, healthcare attorneys and consultants, insurance companies, state, city, federal government, and counties, information technology companies are all scurrying around trying to assure that we will be ready for 2014's implementation of Affordable Care Act. What I'm going to talk to you about today is how one system, your system, Cook County Health and Hospital System, is getting ready for that transformation. Before we get into that, we need to ask one pivotal question. The question is, when most people in this country and most people in this county are covered by insurance, some form of insurance, either it is public or private, or subsidized plans from the health exchanges, will there still be a need for a system like Cook County Health and Hospital System? A system which has got a huge machine, our mission of caring for the most vulnerable population and communities in Cook County. As I'm approaching this transformation Cook County hospital system, which I'm going to explain to you in a few minutes, it is based on the premise that the answer to that question is a unequivocal, resounding, and definite yes. Yes, there will be people who will be still uninsured after 2014. Yes, there will be communities where there will be not enough providers to provide for people even with Medicaid. Yes, there will be shortages of clinical specialties needed by chronically ill. They will emerge out of the closets to get care, which they have postponed for so many years, just because for decades the complete and free access of care is not available to them. And the Affordable Care Act opens the doors for them for the first time in their lives. Yes, as a safety net providers like Cook County, we have an enormous experience in caring for this group of people who are often complex enough, has got a combination of medical conditions, mental illness, substance abuse problems. We understand the social conditions that impact their ability to stay healthy in our communities. The bottom line is a string of all these yeses clearly signals a mandate that Cook County system has to preserve, though it radically has to change in the healthcare delivery system. There is no doubt that the county health system will continue to be sorely needed post-implementation of Affordable Care Act. The simple fact is that we would not survive unless we transform ourselves. We must transform ourselves the way we deliver care. Our patients are depending on us for that. The Cook County has been existent over 150 years. It has got remarkable the first blood bank, the first level 1 trauma center, as well as a long history of innovations in order to be more responsive to the health needs of the communities in pursuing its mission. Its mission to deliver quality health services with the dignity and respect, regardless of patients' ability to pay. Its mission to foster partnerships with other healthcare providers and communities to enhance the health of the public. And its mission is to advocate for policies that promote and protect, that will promote and protect the physical, mental, and social well-being of the people of Cook County. The county health system established the first ambulatory care, which is a string of primary care clinics, which are placed at the very vulnerable neighborhood in the city of Chicago and its suburbs. It opened the one-stop shopping for the healthcare needs of HIV/AIDS population, which today is recognized as world-class and the best in the country. It bears the name as Ruth Rothstein Court Center, a fitting tribute to a leader who made the Cook County what it is today. It is also a greatest hallmark of the public-private collaboration, and it is run with the Cook County Health System with our partners, Rush. Cook County has also entered into a unique and innovative partnership with federally funded health centers throughout the county to seek better coordinate care as the patients move between institutions. Cook County also worked hard to train new physicians and providers with expertise in primary care and chronic disease management. While this rich history of Cook County system is something to be treasured and celebrated, it would be irresponsible to that illustrious tradition if you believe that it can be preserved without changing. The era of reimbursement based on cost and volume of services provided, thereby encouraging heavy use of inpatient services and a multiple visits to the providers, has been the bulwark of the public systems and other healthcare systems in our country. But that is ending quickly. It is coming close to the end because the payers, led by the federal government, are demanding that they get value. They get value for the dollars they spend. The change does not simply mean that I need to change the ledgers in the billing forms. The change means that transforming every part of our healthcare system, from the way we deliver care, from primary care doctor to emergency room, to the hospital to nursing homes, and transforming how all of these elements are connected, interconnected, and coordinated. Doctors need to practice differently as a team to coordinate all levels of care. The information technology must support the transformation and provide the information that will help us to monitor the health status of the patients. Training must be geared to reflect changing practices of the new paradigm and to generate new providers in areas of greatest need. We must put systems in place to manage our patients as they move through the different levels of care and make them active participants in their care as opposed to passive receivers of healthcare system for many, many years. We need to move away from patient education component to patient need to be enriched. They got to be given the opportunity and also the power to demand care and get the best care possible. That patient empowerment movement has got to start. We must put a system in place to manage patients as they move through the systems. We must strengthen our old partnerships and alliances. We must form new partnerships and alliances to assure that no services are duplicated and the critical gaps in services are filled. We must develop, implement, and sustain a financial model, a new financial strategy that moves from reimbursement for individual services to payment of all services for a defined population. That's going to be the future. These are challenges we must meet head on and we must overcome if we are to survive for our patients and for the very health of our community. Here is a strategy Cook County is going to embark on to accomplish all these things. I look at the transformation Cook County system as a 4 distinct but interrelated components. The first one is we must establish a burning platform for everyone. Everyone, including doctors and nurses and financial folks, all our employees, all our funders, all our patients, they all understand that business as usual is not an option and will not be an option. We need to clearly articulate in what we mean to change from a provider-centric to patient-centric model, what it means to everyone individually. How will my job change? What is expected of me in this new environment of care delivery model? We are not only a hospital that waits for sick people to come to us seeking care. We are a health neighborhood that seeks to keep patients healthy and cared for in the outpatient settings. We can no longer rest on our laurels as an epicenter of rescue care, where you bring people out of jaws of death and make them live. We should not put them in the jaws of death in the first place. We must cultivate a new reputation as a public health system dedicated to promoting the health of the community's residents and the health of the communities. We can no longer tout our inpatient services, our complex procedures, our Gamma knife technology. We must look at them as a hallmark of a failing healthcare system. If we really keep them healthier in outpatient settings, then all the needs for them will not arise. They should not be brag values. They should not be revenue-generating cost centers going forward as a system. Next, we must generate a conviction accepted by all, both internally and externally, that our system is really ready, willing, and able to change. The idea that system like Cook County Health and Hospital System is too big to fail is simply wrong. our employees and myself need to understand, appreciate that. At the same time, the perception that the Cook County is not willing, not able to change, not able to take responsibility for its financial sustainability and its quality of patient experience is also wrong. So we need to convince other stakeholders, especially the broader community around us, that Cook County is willing and it is able to change. We must build upon both our tradition and expertise, and also based on new ideas and initiatives emanating from all places around this country, to build and implement our new model of care and create new credibility for ourselves. As evidence of our growing credibility, we have gained the confidence of the community around us. Some of the most important stakeholders in the community who have offered their pro bono services to help us in our transformation process. In this regard, I want to gratefully acknowledge the Civic Consulting Alliance, which have recruited some superior talent from some of the top firms in the country, which I can't afford to buy in the open market, willing to donate time and energy pro bono to help us in the transformation. Among the firms giving their time and expertise for us, Bain and Company, Zeno Communications, Navigant Consulting, Global Economics, and others. In order to build the trust in our financial stability, we are billing and collecting all the amount due to us, and the physician billing has been implemented the first time in our system. We are undertaking creative arrangements with the state and federal government, like our recently approved 1115 Medicaid waiver, that bring new revenues to support our system transformation. We are enhancing our human resources function in partnering with our unions to assure we have the adequate staffing and the right people are in the right job. I want to acknowledge that the Madam President has taken this as an initiative, and I'm thankful to G.A. Finch, who's leading that, together with a lot of people in the room who are here, Andrea, Aaron, Maureen, Terry, together with my, and David LeBreton, together with my teams of Gladia Lopez as well as Elizabeth Reedy, have really taken this on to bring in people in expeditious fashion so the healthcare we can transform the healthcare and provide the healthcare the way we want to do that. I'm thankful to them for their help. We also assure our contracts and are fair and monitored, so we pay real goods for real services, and the outcomes are real, and also we maximize our cost savings. I have a financial strategy based on value, not on volume, going into 2014. On the quality of the patient experience side, we have trained all our medical staff to be medical home teams in the clinics throughout the county. These are clinics built around the providers who have a consistent relationship with their patients, with their own panel of the patients. They take responsibility on coordinating all the care, both inside and outside the hospital. This is the concept of hospital with no walls. Cook County Hospital in the future has no walls. The patients are our patients, whether they are within the four walls of Cook County Health System or outside the system. We will be holding ourselves accountable for their care. We assure that all our services are used appropriately. For example, we assure that the people who go into from the primary care service to specialty care are sent back to the medical home model so that their spots can be opened up for the new patients coming in for the specialty care. We view the hospital, both our emergency room as well as the inpatient service, as a place of last resort when all our efforts to keep patients healthy have failed. We will not see them as a centerpiece of our healthcare system. But the way of background here, in the recent history across the country, a great deal of our healthcare dollars has been allocated to provision of specialty care, as well as tertiary and quaternary care, which requires expert personnel, specialized technology, and facilities. Recently, in recognition of the fact that we have serious misallocation of these funds, the focus has shifted to keeping our patients out of the specialty settings, not by restricting their access, but managing the care better and allocating the vast resources of our healthcare dollars to primary, preventive, chronic, and palliative care. Getting back to the effort to build a trust in the quality of our clinical services, we will provide transparent of our healthcare services and this accomplishment and these details, which will be available to them, assuring that the quality goals are both embraced and enforced. And we have plans to put our measurements and our data on a public website to make ourselves accountable by the end of this year. The third component of our transformation is the creation of a clear vision and a transparent path to the vision. We know what we need to do to transform the organization, but we need to make sure that everyone who works for it, everyone who pays for it, everyone who intersects it, everyone who is cared for by it, need to understand the vision as well. Our vision for the county health system is to be successfully transform our system to a patient-centered medical home model. It's a team-based concept designed to provide quality, comprehensive, and continuous, and most importantly, coordinated care to all our patients. The coordinated care model is designed to improve access to care, maximize outcomes, enhance patient satisfaction, and control cost, and allow the health system to achieve financial sustainability. The model allows our patient to have access to and connection with a primary care physician to ensure that the care is being managed as they move from primary to specialty to inpatient to outpatient care. The key component of achieving our vision is the county health systems is a successful rollout of what we call as county care. County care is a Medicaid demonstration project, which is the result of a 1115 waiver granted by the federal government to the state of Illinois. After many months of intense negotiation, the federal government has granted this waiver, resulting in the establishment of county care at Cook County Health and Hospital System. We are currently in the process of early enrolling 115,000 people into this county care. These are the individuals who are currently under care as uninsured, but they will be eligible for Medicaid under the Affordable Care Act. Under the county care, the county system will receive reimbursement directly from the federal government for the provision of comprehensive continuum of care for the patients who are enrolled in this. It's a risk-based model, and if you keep them healthier, the county gets to keep the money. If you're not very good in keeping them healthy, then there is a potential loss on our county side. With the establishment of county care, we have a blueprint on how to survive, how to continue to be there for the most fragile population as we move into the health-reformed future of this country. In conjunction with the county care, we are forming a network of providers outside our healthcare system to ensure that patients are enrolled in county care have adequate access to full range of services which we are committed to provide. Some of the services are more than what we provide today in a system. The services range from primary care to preventive care, to specialty care to post-acute care, to long-term care to rehab care, to palliative care. Our eventual goal is to all our patients in the system, both insured and uninsured, to be enrolled in the county care so that they can get the services they require. The vision is that the county care will be a foundation for a sustainable, risk-based delivery model for our health system patients. This model will improve quality of care and the patient experience in our system. This model will incentivize effective management of the care. This county care model enhances the health of our patient population, and the overall health of our community. And the county care will decrease the overall cost of care. While our health system has a vision for post-2014, so too the county should have a vision, a strategic direction for those who will remain uninsured after the implementation of Affordable Care Act. As I said at the outset, there will still be uninsured people after the 2014, and there is no question the demand on the healthcare will always exceed the public hospitals' capacity to meet those demands. There is no question that all providers within Cook County must continue to play a role in caring for our uninsured towards the end. We must all work together in developing a vision and strategy for our uninsured for the county-wide. The vision must assure that there is a sustainable healthcare safety net in place for most fragile residents and communities in Cook County. The vision is to establish a comprehensive network of medically vulnerable population in the Cook County. It is including, but not limited to, people with Medicaid, as well as people who remain uninsured after 2014. Cook County health system will be a primary component of this model, but we want other healthcare systems to join us in working out with this. The county-wide network must be designed around the needs of a targeted population, building on all providers' facilities and services, and relying upon the partnership and contractual relationship towards the full continuum of care. Together, all organizations in this country, in this county, public and private, not-for-profit and safety nets, federally qualified health centers and private providers, we'll all have to join together. Together, we must deliver a quality of care that is timely, culturally sensitive, freely accessible, and most importantly, affordable. Ultimately, this county-wide network, those relationship with the Cook County, the state of Illinois, and federal government, will develop and implement a sustainable risk-based delivery model for all residents of Cook County, both insured and uninsured. But having a vision is not enough. There must be a clear path, a clear roadmap that outlines all the steps needed to achieve that. Given the implementation of the Affordable Care Act is less than a year away, there is a palpable urgency to the need to clearly articulate a roadmap for this countrywide initiative. The implementation plan must be a living, breathing document of what we must do, collectively and individually, to arrive at the quality, integrated, patient-centered healthcare network that is financially responsible. The path must have milestones to attain, tasks to be achieved, and the roadmap must be highly understandable. And in a way, it should be very personal, communicating to each and every member and each and every player at Cook County what one must do to achieve that. There will be more dialogues in the future, in the upcoming weeks and months, to discuss this county-wide network of taking care of uninsured strategy. Going back to the fourth component, the final and the fourth component of the healthcare system transformation is to build a top-flight senior leadership that embrace the vision and the path to transformation, and it is committed to its execution. Someone once told me that to be a successful CEO of a public hospital system, you can't do the job if you need the job. You cannot do the job if you need the job. So the leadership of the transformation team must be willing to risk their own careers and ambitions in order to assure the system survives for its patients. This team of smart and experienced senior staff, some of them already here, and some of them will be joining us soon, will dedicate themselves to the creation of new Cook County Health and Hospital transformation process. This team will assure that the ambulatory clinics are truly medical homes. They will assure the services are easily and appropriately accessed. They will assure that all partnerships are developed for the provision of comprehensive and cost-effective care. They will assure our workforce is trained and retrained to assure the services are delivered in a patient-centered environment. They will assure that they will be financially responsible in the allocation of resources, and they will have the moral courage to stand up for those principles. It is the leaders who make the difference in every institution. This was never more truer than in a public hospital system like Cook County Health System. In closing, let me tell you this. Just after a year in Cook County Health and Hospital System, which I have the great privilege to serve, I'm convinced of several things. I'm convinced that the health system like ours will survive in the new world of healthcare delivery model. We need to survive because we need to take care of the needs of the people who will still be left behind after the 2014 Affordable Care Act. I am convinced a health system like ours won't survive unless we make dramatic changes the way we deliver care. I'm convinced that making the transformation is very difficult and requires enormous internal and external support and a commitment and a transparent plan of achieving our vision. And I'm convinced that we are on our way to that transformation process. Don't misunderstand me, because this has got a very steep hurdles we need to cross. The expansion of Medicaid Illinois has got to proceed in a timely fashion. I realize that we must maximize the opportunities inherent in our 1115 waiver. In order to succeed in the transformation and the successful rollout of our county care, we must be able to surmount the historic hiring obstacles facing our system and allow the rapid and flexible hiring of critical staff and talented leaders from all across the country. We must continue to expand on our good relations with the state to build a model of care that can be emulated in the rest of the country. We need all the great minds of a community and elsewhere to help us in this process. Given all the challenges, I am really optimistic. I am optimistic that we may not be too big to fail. I'm optimistic that we are too good to fail if we do the transformation. Thank you, and thank you for giving me an opportunity.
If you have questions, City Club E, well, go through there, Estina. There's always way in the back. Tweet, help her out. You're the messenger? Doing a good job. Next time when you're the messenger, make sure they sign their name. Please provide a list of the population that will be covered under the Affordable Care Act. Every person?
Good question. The population is the three components. One, they must be legal citizens or legal residents in this country. They should live in Cook County, and their income should be below 133% federal poverty limit. Those are three components. In the past, to get a Medicaid Illinois, you got to be disabled, or there's a group of people who are called ABD population. For the first time, under the Affordable Care Act, the Medicaid rolls will expand to include people who are purely based on income will be covered under the health insurance plan.
This one is from Clint Sabin, Howard Brown Health Center. What would, by the way, excellent printing. What would the consequence be? What would the consequence be if the General Assembly does not pass legislation to provide federal financing for Medicaid as required by the new federal health care law? Ooh.
That will make our life very, very difficult. Because we need to cross three major milestones going forward. The first one is a county care, which is going to be the future roadmap or a plan for how the care will be delivered in Cook County Health System, taking risk-based model, medical home concept, continuous coordinated care. County care at the present time is a demonstration project, right? It's supposed to expire on December 31st of this year. To continue the county care as it is, we need to, Illinois has got to expand Medicaid so that patients will be eligible for Medicaid. Otherwise, these patients will end up with no insurance at the end of it. And the second thing we need to get it done is the county care has got to be approved by the Department of Insurance as a managed care plan, a care coordinated plan. The kicker is that they need to approve us without need for any reserves, because usually managed care plan need to have reserves. So that's the second hurdle. The third hurdle will be that county care should be allowed to compete in the health exchange as a low premium, low copay health plan, so that people who are poor, who just go beyond the poverty limit of 133%, or small business owners could be able to buy this product in the health exchange. So we have to get three things done. The first thing we need to depend upon is expecting the state to approve the Medicare expansion. So that is critical.
Okay. This is from Darcy. Is that Yvonne? UIC. What role does philanthropy? I can do this. What role does philanthropy play at Cook County, and what do you expect moving forward?
Philanthropy should and will play an important role, because one aspect of what Civic Consulting Alliance is giving us is a philanthropy in the form of expertise, brain power, and ideas, and people are working pro bono to transform the system. As a part of this, Cook County also established a foundation, a separate 501c corporation, so that they can accept funding, which are able to manage their care as a part of it. We want the philanthropy to support us, because we will show that we are a system which takes itself very seriously, and we are responsible, and we will transform the system so that we are there for the people who need us at some point. So any philanthropy is very well welcome, appreciated, and you can probably start today. Unless there is no soliciting allowed in City Club.
People solicit here all the time, sir. Don't. How about a big round of applause for our speaker?
Thank you.